Our next session, Nutrition for Kidney Cancer, will be presented by Ray Palco, a registered dietitian at Fred Hutch Cancer Center in Seattle, Washington. Please see his full bio in the program section of the meeting platform. And since the rest of our sessions will be presented live today, be sure to submit your questions in the question box on the right-hand side of the screen. Thanks so much for being here today, Ray.
Here. Okay, let me get back. There it is. All right, good morning, afternoon, or evening to everyone, wherever you might be. As Amy said, my name is Ray Palco. I'm a registered dietitian and board certified specialist in oncology nutrition, and I am joining y'all from beautiful Seattle, Washington. Before I get into my presentation on nutrition for kidney cancer, I wanted to do a little quick ad hoc segue to that last presentation I heard. I believe the gentleman's name was Dr. Janish, and he was promoting clinical trial involvement. Very serendipitously, today, September 9th, happens to be the birthday of my original and greatest mentor to become a healthcare provider, my mother, the retired nurse, Barbara Palco, who was a diploma nurse. If any of y'all know what a diploma nurse is, you know what a diploma nurse is. She took her career as more of a vocation and really guided many of our family, friends, and community members through their journeys. And she always promoted clinical trials. She may have just been being a little sneaky or savvy, I don't know, but she'd always tell everyone, the best care comes to those in the trial. Do the trial, do the trial. So really, if it's available, do the trial. All right, so nutrition for kidney cancer. I have the challenging task of trying to squeeze everything that lives in this brain about this topic to you all in around 30 minutes. So the aim of my presentation is really going to be more of a broad level lens, looking at some of these big highlights we may consider for our nutrition when affected by kidney cancer, whether in the active treatment space, survivorship, and even for individuals who may know that they could be at an elevated risk and things we may modify to try to lower that risk. Starting out with a few recommendations around our nutrition during treatment. Some of the major priorities that we have. We really want to be achieving adequate food and beverage intake for maintenance of our lean body mass. Lean body mass is what we commonly call in the lay world muscle. And this is something that is very protective of all aspects of our health, but when going through a cancer treatment is extremely vital. Now, ideally, we are not going to change our diet too much. Excuse me. Ideally, we are not going to be changing our diet too much from its normal baseline. There may be some certain modifications that we want to make, and the treatments themselves, whether surgical, chemotherapy, immunotherapy, or radiation, if we are suffering from any nutritionally impacting treatment side effects, then we want to modify our food choices, textures, or timing to better meet your nutritional needs. These nutritionally impacting side effects that I speak of could include things like nausea, diarrhea, mouth sores, which the medical term is mucositis. And as I was hearing the end of the last presentation, I believe that cabozantinib may have been mentioned by one of the physicians. Any of y'all who have been on cabo, you know that that can definitely lead to those mouth sores. Meeting with a registered dietitian can really help you identify what type of beneficial changes you may want to make. I want to share with you a few examples of some diet modifications and provide you with an excellent resource, since we don't have enough time to deep dive into each one. I'll highlight nausea, diarrhea, and mouth sores / mucositis. When we are suffering from nausea, one of the frontline things to help relieve the nausea and still maintain adequate nutritional intake will be shifting to smaller meals with more frequency. So if we follow the traditional classic 3 meals a day, breakfast, lunch, and dinner that most of us are accustomed to, we may find that if feeling nauseous, we can't really eat a full-size meal. Better bet then is to shift into maybe 5 or 6 smaller meals throughout the course of the day. This recommendation is frequently rubber stamped for anyone going through cancer treatment to say, eat 6 small meals a day. There's nothing magic about that number. It's based on the assumption that you are eating 3 meals a day at baseline and that you are only able to eat about 50% of your meal in a given time. We all come into a cancer journey with a different baseline diet. Some individuals may only be eating once a day at their baseline. And so the small frequent meal example for that says, well, we surely want to eat more than once a day. And, while around 5 or 6 times may be an ideal, another thing I want everyone remembering for every aspect of their nutrition in or out of treatment is please never let perfect be the enemy of good. In terms of diarrhea, which diarrhea is defined as a liquid bowel movement, we can include different foods that are rich in soluble fiber into our diet. And this soluble fiber, this dissolves in water in our GI tract, but reconstitutes as kind of a thick, viscous gel. So that can help to add some add some firm to the stool and decrease the episodes of diarrhea. Soluble fiber-rich foods include things like oats, applesauce, and banana, but there are many, many more that could be utilized. Lastly, with those mouth sores, a nutrient-dense smoothie may be substituted for a meal and could be very helpful. Also with the mouth sores, we want to be thinking about what can we eat that minimizes the pain that can happen to our mouth. With all of my patients in the clinic, I always say, let's talk about what not to eat. I would prefer that you didn't go to the Mexican restaurant and get a bunch of tortilla chips fresh out of the fryer and a big bowl of salsa. Too hot, too sharp, too spicy. And then once we get that idea, all of a sudden it's like, aha, now I know what might be better to eat. So there are more nutritionally impacting symptoms or side effects that you may deal with in a cancer journey, more than we have time for today. But to give you all the resource, I have the QR code listed here on the slide that you can scan, and that'll take you over to this guide here. This is the 2022 edition of the Eating Hints Before, During, and After Cancer Treatment. This is issued by the National Cancer Institute, and it's basically the next best thing you can find to a live registered dietitian if you're going through cancer treatment. So I know that different cancer centers have different variability in terms of how they provide dietitian access. I also know that my colleagues in the oncology nutrition world completed and published a landmark paper within the past few years that showed that there is only one registered dietitian for every 2,308 patients going through cancer treatment in the United States. So this is a need area that we're really trying to get more. And if any of y'all are here at the Hutch and you have any trouble eating, you tell Dr. Tykoti, Dr. Hall, Dr. Bhatia, whoever it is, you say, refer me to Ray, and we will be thrilled to work together. We've got a stacked team here, but I know all centers are different. Okay, survivorship. Let's hop over here. So I have a website address for you up top, www.aicr.org. This is the American Institute for Cancer Research, which is an excellent organization that provides us recommendations for cancer prevention. I have the PDF of their most recent edition. These were released in 2018. They are revised every 5 to 10 years, so I'm looking forward to something new soon, although the revisions don't tend to change the gist too much. Please go over to the AICR website. Use that as your evidence-based resource for all types of learning around nutrition and cancer. We all know the internet can be a bit of a hornet's nest. A Google search of the word cancer may yield you much information that may not be evidence-based or may be flat out fraudulent. AICR is your great go-to for nutrition information. We don't have time to deep dive each of these recommendations here, but I will on the next slide give you my simplified version. Also to the other side of the screen here, you see a graphic that says CUP report on kidney cancer. So AICR does these CUP reports, continuous update project, to help us understand what type of food, beverage, or behavior may be associated with increasing or decreasing a cancer risk. It's very small here, what you see for kidney cancer. Unfortunately, the level of research in this field is not where we want it to be yet. The only strong findings that we have is that our risk may be increased by body fatness or adult attenuated height, which is a really funny thing. There's nothing we can do to modify our heights. And conversely, our weight is often very difficult to modify as well. We'll touch on that on the final slide. The only things we see preventative for kidney cancer risk is a very bizarre little conundrum. We see alcoholic drinks. Now, you also see over here that we overall recommend limiting alcohol consumption. This is due to the fact that alcohol is a potent carcinogen, elevating risk in any type of gastrointestinal cancer and breast cancers. The beliefs about possible reduction in kidney cancer are not fully understood. One of the main pieces is the diuretic effect of alcohol, maybe that it's diluting any type of carcinogenic solutes in the kidneys and we're expelling them sooner. But there's all those other risks with alcohol, and a good cup of coffee or tea is a diuretic also. So I would not recommend anyone utilizing excess alcohol as a prevention mechanism. Okay, these recommendations here, again, they are for prevention, but this one recommendation also states that cancer survivors should follow the same to assist them with prevention of recurrence or a further cancer. So here's my simplified version, everyone. This is a little graphic that came out of my brain here. On our left side, we have like a plate kind of making it real food. So on this little axis plot that I've created here, these are my 4 food groups, and I want everyone to consider that any food we eat first comes from one of 2 origins, either plant or animal based. Our plants grow up out of the dirt. Our plants grow up running around on top of the dirt, flying high above it, or swimming well below it. Plants or animals. Then we'll make 4 groups by separating those 2 out into 2 further categories based on the integrity of the food. Now, what I mean by the integrity of the food, at the point of consumption, by the time things are resting on your plate, like this graphic here, how closely do they still resemble our origin? From this, we will make 2 more groups. We have whole foods. These appear on our plates looking like they have a home in nature. We have my favorite whole plant food here to illustrate the point, broccoli. To me, this literally looks like a shrunken tree. It looks kind of like my virtual background there. You can't deny that that came from the earth. So we've got whole foods. Then we also have processed foods, and these will arrive in a shape, size, or color that doesn't occur in the natural world. As we're looking to this little background graphic behind me, it's a little dark, so you can't fully tell, but I promise you that none of those trees have a neon orange triangle-shaped Dorito appearing leaf. So as we think about our foods along these lines, here we have our plant on this side, our animal on this side, whole up top, processed on the bottom. I've arranged the plate in stoplight colors. The stoplight system is something that's really been utilized in multiple spaces to help guide healthy nutrition. Originally, I believe this was originally a public health initiative out of Boston for beverages, where they would call, water is green, have it all the time. Maybe a lightly sweetened beverage or like coffee or tea might be yellow. Have it, frequently, pay attention, right? And then soda would be red. Really want to try to avoid. So just like our traffic lights, green means go, yellow means caution, red means stop. So I've plotted here our whole plant foods, including things like apples, oatmeal, broccoli, and chickpeas, our whole animal foods, things like fish, chicken, turkey, eggs, and milk. And then the processed plant foods could be chips, soda, gummy bears. Processed animal foods could be bacon, cold cuts, hot dogs, etc. So staying mostly in the green, and we're going to be in good shape. Okay, myth busting is another topic that Amy said would be interesting to discuss, and I could spend more time than anyone has today trying to myth bust. So I really wanted to focus in on one of the most prevalent ones, which is the concept that sugar feeds cancer. And now I also have to be not black and white and tell you that this is a partial myth to say that sugar feeds cancer. The partiality of it is that, yes, it does, but the truth is that all foods that we eat feed both our healthy cells and a cancer cell. Lots of the origins of the sugar feeds cancer misperception lie around the fact that in some of our imaging, like a PET scan, radioactive glucose is injected and then the scan is done and it lights up and people say, aha, tumor, eating sugar, sugar feeds cancer. While yes, that's true, again, that's all that radioactive glucose in there, but like that tumor is also uptaking any other type of nutrients that are in the bloodstream. We know that sugar or carbohydrates can feed cancer cells. The researchers here at the Hutch have been giving us some interesting educational talks about how they see cancer cells gobbling up fat, and they love to eat that. Protein, we know, is the building block of every single cell. So all three of those macronutrients that provide us calories and energy, unfortunately, can feed the cancer cells as well. This is why we put individuals through things like surgery, chemotherapy, immunotherapy, and radiation. If we had a technique where we could remove that cancer and cure it with diet alone, I'd be like the most important person in the cancer center. It would be really cool. We'd love it, but science isn't there. And frankly, with an understanding of human digestion and metabolism, there needs to be some scientific discoveries that really change things before we could ever have a technique that we could starve the cancer alone and nourish the healthy cells. So what I want you all to take out of that is not to go home and say, okay, cool, 12 pack of Pepsi, crack it open. I want you to know that sugar is a huge, wide, broad umbrella. If we travel back to that previous slide, which, I have the control to do that. Sugar in here. Sugar in here. Any plant food has some degree of sugar to it. It's largely, the whole plant foods are in complex carbohydrates, and carbohydrates should be making about 50% of our caloric intake in truly balanced diets. So remember that sugar is this huge umbrella, but then also remember that these sugars down here, this is the stuff where we want to keep some more caution. But one other important consideration for anyone going through active cancer treatment, there is a small modicum of research that is pointing us in the direction that overall healthier food intake corresponding to my 4 food groups and sticking in the green or yellow, that may have some additional advantage when we're going through cancer treatment. However, we absolutely know that malnutrition during cancer treatment is very predictive of poorer outcomes, and oftentimes mortality in patients living with cancer is more malnutrition related than disease or treatment related. So I say all that to say, if you're going through cancer treatment, the worst possible calories that you can ingest are no calories at all. So it's not to say that we, never ever have any, but by all means, and you can see on my badge, I keep an ice cream cone pin here. It's all right to have a little. Okay, now, since this is a kidney cancer discussion, it's a really good idea to be thinking about how our nutrition overall affects our kidney health. There's a common question about renal diets. I would give one humble suggestion to any of my oncologic or surgical colleagues who may be listening to the talk. I think something that can be very effective and help to set your patient's mind at ease with the very initial visit is letting them know that they do not necessarily need to follow a renal diet. So renal diets, these are indicated in individuals with kidney failure, but not kidney cancer. Even if you have part or one of your kidneys removed or one of them is affected by a tumor, we have steps over here that you can follow that will keep your remaining kidney healthy. And part of the way that human beings are designed, we've got 2 kidneys when we really only need 1. Now, important for me to say, I don't want this message to say there would never, ever, 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 ever be a chance for a renal diet. Sometimes kidney cancer is overlapped with kidney failure. Sometimes the kidney cancer is aggressive enough to induce more of kidney failure type states. The renal diet is very restrictive, and the main function is preventing the individual with kidney failure from accumulating dangerous and possibly fatal levels of potassium and phosphorus and magnesium in their bloodstream because the poor kidneys aren't able to filter it all out. Even patients on hemodialysis will have regular laboratory checks and their dietitian and their treatment team will guide them to safe levels of phosphorus and potassium. So it's and also something really interesting, back to my point about worst calories or no calories at all. My previous job was at Stanford Hospital in California, and that hospital had actually removed the renal diet from the diet order set in the hospital, because we find and we know if you are ill enough to be admitted to the hospital, it's going to be a tough enough time eating anything. And then if we throw this very restrictive diet order at you, it's going to be like no calories. So, good point there. The focus on keeping a healthy kidney, and this is from the Canadian Kidney Foundation and was shared with me from one of my colleagues here at the Hutch. Her name is Jenny Chu. She's an awesome dietitian as well. So, here's some of the highlights. Feeding a healthy diet. We focus a lot around plant food in that healthy diet. Think back to my earlier example of, green, yellow, red. Another metric we have is we encourage everyone to make their meals at least 2/3 of the volume coming from plant food, 1/3 or less from animal food. Even for nutrients that have been traditionally associated with detriment in kidney failure, like phosphorus, plant-based phosphorus is much less damaging to the kidneys than animal-based. So having, maybe omitting the meat from your chili, or if you just can't live without it, maybe you scale it back to like a quarter of the recipe and you up the beans in there, and that's going to be better on the kidneys. Avoiding smoking, a myriad of reasons to avoid smoking. It will hurt and damage the kidneys in terms of carcinogenicity. We all know that lung cancer is a big risk with smoking, so is bladder cancer. Keeping them fit and active. Move, move, move. Great sort of double plug here. I'm in my cycling jersey. If I come to work on a weekend, I don't bother to bring business clothes to change back into. So I'm wearing my jersey from the Obliteride. And y'all in Seattle or Fred Hutch people, you know what that is. And I hope to see you on the ride next year. Keeping that physical activity, another point. The AICR recommendation is great here. Stay active every day, move more, sit less. Keep your kidneys well hydrated. Lots and lots and lots of fluid. And fluid can take many forms. It can be water. It can be, if you're making a smoothie that's fluid rich. It can be, broth. It could be juice. We don't necessarily want a lot of juice. Could be our milk or our plant-based milk alternatives. Fluid needs are intended to be individualized. If you're ever getting treatment anywhere and someone throws what feels like a rubber stamp figure at you, oh, drink this much, feel free to ask them, what is the right amount of fluid for my weight in kilograms? In general, most of us adults are needing somewhere between 30 to 35 milliliters of fluid per kilogram of body weight. Reducing salt intake, eating less restaurant food, using less salt shaker at the table is a great bet. Okay, good. I'm going to hear on my last slide now. I'm just looking at my time. Told you all I was wordy. It's tough to say this all. I wanted to put in a point also around weight management. This is one of my subspecialties, weight management within oncology. This is an extremely busy graph that I don't want anyone stressing their eyeballs or brain trying to read now. If you'd like to further take a look at it, in a search engine, you could just type in the Obesity Society potential contributors to obesity, and you'll find this graph. What this is showing us here on the left-hand side are showing things within the person, in our body, that may contribute to extra energy storage or excess weight accumulation or obesity. That's the stuff within us on the left. On the right are the things outside of us. And it really goes away from just, this common narrative of like, ooh, just eat less and move more. But outside of the person, the environment that we live in, the amount of walking trails or sidewalks around us, even things like our mother's weight status and what she ate when she was pregnant can affect our weight status. And I really just want to, we don't have the time to deep dive on how would we safely lose weight, but I want to encourage anyone seeking any weight reduction, this top bullet point, avoid unsustainable diet and exercise patterns. We may remember the television show The Biggest Loser that puts contestants under extreme exercise conditions and extremely low diets. Large amounts of weight loss were achieved. once taken out of that extreme environment, the weight all returned. So the best things that we can do to help possibly foster weight loss, or even if we don't lose weight, improve our metabolic health and decrease negative health risks, are working on gradual caloric reductions by decreasing some of those high calorie or those red type of foods like soda, chips, and candy, while increasing nutrient dense foods in the green and yellow like vegetables, fruits, and lean proteins. Also working on physical activity with long-term daily activity as a goal. And my thing here, build out, build up. We want you doing something every day. If you do something for roughly 30 minutes a day, that's great. But if you're starting with just one day at 5 minutes, maybe instead of week after week going from 5 to 10 to 15 to 20, maybe the first week you have 5 minutes of activity. The next week you say, I'm going to do 5 minutes on Monday and 5 minutes on Wednesday. And then you do that until you're 5 minutes a day, and then you build up. All right. That, I believe, I hope I don't have another slide. Perfect. Thank you, and ready for any questions in our remaining time.
Well, thank you, Ray. Such good information. We do have a few questions. Are there any recommendations for kidney cancer and caffeine usage? You mentioned you noted caffeine. How many cups of tea per day is too many? Same could be said for coffee, soda, things like that.
Yeah, so caffeine wise, I do not have a specific, it may exist out there, and forgive my ignorance, but I do not know of a specific milligrams a day. But something to be considering when we're thinking about that fluid need. If you needed 2 liters of fluid and you drank like 1.5 liters of coffee, that excess amount of caffeine would be getting to a diuretic function where you wouldn't necessarily be meeting your fluid needs. But if you need 2 liters and you have between 1 and 2 cups in a day, that's a totally fine and a reasonable thing. So overall, absolutely fine to have caffeine coming from coffee or tea. Sodas, we would want to have a consideration from all that added sugar. So I would say keeping it to a more modest amount. Or if you're like a true Seattleite and it's like coffee, coffee, coffee all day long, branching into the world of decaf and even doing some half calves may help you out.
You mentioned meat-based phosphorus is worse than plant-based. What about phosphorus in cereal?
Yeah, great question. So phosphorus in cereal, the bulk of that will likely be added phosphorus. And yeah, so there's another dimension to it. So the plant-based phosphorus is less detrimental to the kidney health than the animal-based, but added phosphorus overall. So you see that in things like cereals, energy bars, other things. If the phosphorus is naturally occurring as part of that plant's natural body, it's a whole lot less absorption. But whenever it's added in, so like if anyone had any adjacency ever to those renal diets, and you'd see we advise no cola, but Sprite or 7 Up would be okay. Yes, so phosphorus in the cereal is very much likely added, and you can learn that by reading the ingredient list. And if there are any names on there that look like phosphorus, phosphatate, things like that, that is added in, and that would be similar to that animal-based phos.
A couple more questions. You noted the importance of whole plant food, but how would you recommend approaching foods if someone is experiencing GI side effects like diarrhea and can't tolerate fruits and vegetables, but might better tolerate more process-based foods?
Yes, great question. I would direct them towards those more process-based foods in the time. And that really does kind of hit back with that statement about worst possible calories or none at all. And that's in that arena of kind of the dietary modifications. So actually further recommendation on diarrhea, generally we always encourage whole grains because they are higher in fiber and have more vitamins and minerals, but that extra amount of fiber will further exacerbate the diarrhea. So we would recommend white rice, white bread. So yeah, it's always in the moment. Another sort of statement for this is that healthy eating looks very different for every stage of our life cycle. You would not, that plate that I showed with that chicken and all that broccoli and quinoa, you wouldn't feed that to a 3-month-old. Healthy nutrition is very different for every stage in the life cycle and pending our medical circumstances. So it's okay to deviate away from any of those kind of ideal healthies if it's what you need during treatment.
And one final question. This might be kind of a difficult question. It probably varies, but what supplements might someone consider using, to maintain good nutritional status during treatment?
Excellent question. So that is actually one of the AICR guidelines, is to not rely on supplements to be our form of cancer prevention. So especially when we delve into the treatment space, I encourage anyone to have a good conversation, not just with their oncologist, but also ask them about dietitian access. But honestly, better than us is the pharmacist for your cancer center. The most important thing with supplementation during treatment is ensuring that it does not interfere with your treatment. And many different supplements are providing pharmacological values of a nutrient. I will give an example. Emergency, those little packets that we down in our water, that's the same vitamin C as eating 20 oranges. So it's really, first, we want to vet out that it's not interfering with our treatment. Second, a general multivitamin that is providing roughly 100% of the recommended dietary allowance of all vitamins and minerals can be an excellent insurance policy if you are having all that diarrhea and needing to eat a lot of white bread. Third, vitamin D is the one nutrient that almost everyone needs to supplement to maintain adequate levels. So that's an important point. And lastly, dietary supplements, unfortunately, due to legislation that was crafted as I was graduating 8th grade, I will remain nonpartisan and not state names or parties or anything else. But this legislation has allowed dietary supplements to operate very free of regulation.